The leading cause of hospital readmission for seniors is complications from chronic conditions like heart failure, diabetes-related issues, sepsis, and falls resulting in fracture of head injury. Today's topic, we are breaking the circle why seniors keep returning to the hospital and how together we can stop it. Hospital readmission is a massive concern for families and healthcare providers. This episode, we're going to bring actionable insights, prevention of common readmissions, and focus on chronic illness management, infection prevention, and post-discharge care. Today, we're talking about a serious topic here. Why seniors keep going back to the hospital? Why? And what can we do about this situation? You know, we're not scared person. We find a problem and then we identify how to care for it and give you the insight into seniors' health and caregiving. So today we are discussing this growing concern and why so many seniors are returning every day. I see this every day. And after discharge is when the work starts. This is a serious issue affecting families when it comes to readmission. But here's the good news. With the right knowledge and a proactive steps, we can reduce the chances of readmissions. So today, I need all my people to listen. The most common reasons seniors are being readmitted, and how can we recognize these warning signs and the troublings and the practical steps to break these hospital revisits. Most times when we get a call, it's because families things are going away, patient was going back and forth to the hospital. So let's talk about the biggest reasons why seniors are being sent back in the hospital. Chronic conditions like heart failure. Seniors often miss the subtle signs like swellings, weight gain, which can spiral into crisis. Pneumonia is the second one. Pneumonia and respiratory issues. Breathing problem, especially after illness. Diabetes-related complication. Poorly managed blood sugar can cause everything from infection to confusion. Infection like sepsis or UTI. These are common reasons often overlooked until they are severe. Falls and injuries. A fall can lead to fractures and head injury or even internal bleeding. Here is a true story of one of my clients. We're going to call him Mr. John, who was discharged after heart surgery. He was doing fine until he started gaining weight rapidly, a sign of build-up fluid. His family did not know that this was a red flag and ended up back again in the hospital. That was way before we got him as a client. These are preventable situations if we stay informed. Recognizing the warning sign. The key to preventing readmissions is to catch the warning early signs. Watch for things, red flag, like heart failure, unexplained weight gain, swelling in the feet of the leg, or trouble breathing, infection, fever, confusion, or change in urination pattern. Diabetes issues, extreme thirst, blurred vision, or unusual fatigue. After surgery, we want to look for redness, swelling, or drainage from the wound site. If you notice any of this, don't wait. Contact the healthcare provider immediately. Early intervention can save a life and spare your loved one from back and forth to the hospital stay. Now, let's talk about solution. What is the solution? Here are 5 ways to prevent hospital admission. Number 1, follow-up appointment. Never skip the post-hospital check. These visits help identify problems early. Number 2, medication management. Keep a list of all your medication and set a reminder to take them as prescribed. Number 3, home health care service professionals. Caregivers can monitor vital signs, assist with wound care who are trained by a nurse, and provide physical therapy. So home can provide all this. Create a home environment to remove tripping hazard, grab bars, and ensure good lighting. Stay hydrated and active. Dehydration and inactivity can worsen many conditions. Encourage light activities if safe to do so. If you also develop a free post-discharge checklist, we have created that for you to guide you through for your first 30 days after your loved one comes out of the hospital. After hospital readmissions, they are very stressful, but they don't have to be. With the right tools and awareness, you can protect your loved one and give them the best chance at recovery. Again, as Nurse Plus saying, when I go out to look out for a family that just came out of the hospital, there are basic things that I'm looking for. And I train family for those families who are not also ready for home care. When a family comes out of the hospital, I tell people every day, that is when the work starts. That is when we have to pay attention. That is when we will have to make sure all the right implementation are put in place. You don't want to end back in the hospital. You don't want to end back in the hospital. So that is why I'm going to give you the secret of what I use to prevent 30 days readmission. When I go out to check the family, so the first 48 hours after discharge, you want to do a follow-up appointment must be in place. You want to review your discharge instructions and medications, identify the red flags to the diagnosis. For your daily tasks, you want to check your vital sign, temperature, blood pressure, and oxygen saturation. You want to monitor any changes in your condition like swelling, fever, confusion. All those things is what I'm breaking down for family. Now your weekly check is you want to confirm and follow up all scheduled appointments. You want to address whatever thing you are confused on with your healthcare provider or your nurse. Also, home safety. In your home, is your home free of tripping hazard? Are all your medical supply all available? Is your emergency contact readily close to you if you need it visible? Re-hospital admission is what we see every day. And our goal, with the help of Nurse Blessing and White Dove, we will implement all the right process so that your loved ones can heal and feel better to what their life used to be. Hospital is not a place we want it to be. It's a place we will do our best to keep you away from it. Contact White Dove for any question or any advice that you need to keep your family and your loved ones out of hospital for another re-hospital admission. I'm your girl, your nurse, your friend from White Dove Health Agency, Blessing Care Corner.